Patient's chest tube came back. Look at the chest x-ray. It came back. Patient got shortness of breath. Patient's breath sound a little weird. What's going on with your patient? You might want to find out, because knowing what we're talking about tonight could save your patient's breath, could save your patient's life. We're talking about pleural effusions on tonight. I'm so excited about this subject because we get to do acute care from the Quick Facts for Nursing School. This is also in your Quick Facts for NCLEX book, but the Quick Facts series covers it all. This is the reason why I wrote this book, to save you time, to save you to save your sanity. Let me just keep it real. Just to save your sanity, we're going to be diving into pleural effusions tonight. Hello, if it's your first time watching, my name is Professor Regina Callion. I've been doing this for a few days. And I am here so that you can get your nursing license ultimately and join my wonderful profession of licensed nurses. We're making a difference in this country. And when I see people looking for jobs, and when I see people saying, oh no, it's so hard for me to find a job out here, I cannot relate, because literally just today, I got a text message from somebody that said, hey, there's jobs in hospitals around you. We need nurses. And so your phone will be blowing up like this very shortly. I believe it. And I'm looking forward to it. Another thing that I'm looking forward to is our next big study session. Let me know where you are in the comments too. Let me know where you're from in the comments. I love that. I love that energy. But our next big study session is this. Pow! We got love your content. Valentine's Day is coming up. And if you don't have a date, I have the date for you. It's actually 2 dates. It's February 12th and February 13th this year at 9 p.m. Eastern time. Set your alarm, because Love Your Content is where we focus specifically on maternity, pregnancy, and because it's Valentine's Day, we're going in on sexually transmitted infections. We're just going to mix it all up together because, on Valentine's Day, we like to think nursing. And when you think of nursing, you think of relationships, you think of STDs. So we're just going to put it all together. It's a 2-day event. I want you to join me there. Sign up for it. It's really easy to sign up for, actually. All you got to do is go to remarnurse.com/love. So it's just my website, Remar Nurse. If you haven't been to my website ever, take a trip there today. remarnurse.com and /LOVE, so that you can get the workbook. You can get, just the times that we will be going over it, because we actually do case studies and critical thinking during Love Your Content. So it is not to be missed. And I'm really looking forward to doing that 2-day event with you. Also, again, we're going to be studying from pleural effusion on tonight. So that's going to be a great opportunity for us to dive into content. We're just going to take it in a different direction for tonight. Now, with pleural effusions, I got to get out our study, the way we study. And the way that we study around here for pleural effusions, let me go here. Okay, the way that we study is going to be, is our clipboard. So let me get our clipboard ready for us. And we're going to go over just where you are. We're about to see where you are with it, with your content, with your foundation. And then we'll go into the practice questions, okay? All right. Look at this. Look at this testimony from Nurse Garcia. Nurse Garcia, says, hi, Regina. Thank you so much for your lessons. I've been consistently watching your lives and doing the V2 and Quick Facts. Just now waiting for my ATT. ATD stands for authorization to test. That's the go button. That's the green light. That's where you can schedule the test. God bless you. Oh, thank you so much. I'm looking forward to the testimony at the end of this journey specifically. But one of the Remar nurses says, you can't have a testimony without the test. So I'm looking forward to your test. Nurse Amelia says this, hi, Miss Regina, I give all the glory back to God. I tested Saturday. Okay, check this out. Today is Wednesday. She came back, said she tested Saturday, and passed at 115 questions on my first trial. Okay, thank you so much for all you do. I am officially, look at this. Look what she did. A Remar safe nurse. If you got it, you got it. If you caught that, you caught that. I am a Remar safe nurse. Wow. Wow, wow, wow. That just warms my heart. Congratulations. Congratulations. So good. You guys are too much. You are too much. Hello. Hello, everyone. Putting Remar safe nurse together, Remar nurses. Okay. For the rest of you, can you see this? Oh, I hope you can see this clipboard. Oh, okay. All right. Let's do it together, okay? We are talking about pleural effusion. Do you know what? I got influenza. Whatever that flu was, that went around, it keeps like wanting to creep back up. I don't know what it is about this season's flu, but it is aggressive and it is annoying and it keeps trying to come back up. Okay. So we're talking about pleural effusion, not pulmonary edema. So this PE is PE, pleural effusion. Now, we are talking about fluid, right? Whenever we see a pleural effusion, we're thinking of fluid, and we're thinking of fluid where? We're thinking of fluid in what organs, what's surrounding the organs. We're thinking of fluid, and then NCLEX is going to pair it with the lungs, okay? So we just got to make sure that we are not getting confused pleural effusion with something else. So let me do this. Okay. When we talk about fluid for pleural effusion, is that fluid inside the lungs or outside the lungs? Here we go. And this is the part of class where you show up and you just say, it's Wednesday, it's hump day. I don't really feel like studying, but let me give this my full attention because this information is money. Okay. I want you to think about this like, if you know this, you get $50, you get $100. Because that's what it's going to be. So pleural effusion, fluid is outside the lungs, okay? With the pleural effusion, don't mix this up. Fluid is outside of the lungs. It's outside of the lungs between that lung and that chest wall. See, this is why we're going over this information, okay? Now, there are many causes why a person might have developing a fluid problem. For pleural effusion, yes, in the pleural space, what is going to be a more common reason? Is it going to be liver disease or infection? Think about it. Think about it. This is where we connect our pathophysiology. Okay, we mean when something's off, something's not normal, to symptom presentation. All right. And let me say this, both answers are right. You can get a pleural effusion from liver disease or infection. Which one is going to be more common? You can't put your own thing on there. You have to choose between the two. Is it liver disease or is it infection? Okay, it's going to be liver disease. This is going to be more common. Liver disease, kidney disease, you're going to have a buildup of fluid. That's going to be more common than an infection that has gotten so bad that it causes pleural effusion. All right. So liver disease more common. Now, on assessment, nurses, registered nurses, practical nurses, either one, I don't discriminate. This class is for you. Crackles, low breath sounds. Crackles, low breath sounds. Which one? Which one are we going to be expecting to auscultate? Are we going to be hearing crackles or are we going to be hearing low breath sounds? I'm asking you the questions that challenge your critical thinking. Okay? Because I know you've memorized some facts, but we're going to do critical thinking tonight. Correct answer here, we're putting it all together, low breath sounds. Low breath sounds here. Because where's the fluid? the fluid is outside of the lungs. So it's going to be like a layer that gets in between what you're supposed to hear, the air, right? It's not going to be what we call resonant because there's going to be fluid there. So low breath sounds, not crackles. Crackles are where? Inside the lungs. We said this was outside. So let's put it all together. Put it all together, and what do you got? Okay, low breath sounds. Are we going to expect for the patient confusion or anxiety? Oh, this is good. What's going to be more prevalent, confusion or anxiety with pleural effusion? And I see the answers coming in. Come on, follow me. Remember, this class is free. You pay for it by what? By commenting. That's your tuition to this class. Commenting, liking, smashing that share button. That's all. Correct answer, anxiety. Anxiety. Okay. Patient can't breathe. They're going to be restless. They're going to have anxiety, not necessarily confusion, okay, with hypoxia in the same way. Anxiety. We together? Okay. Last question is this. It might be a little small to see. I'm talking about how are we going to prepare in our minds to treat this? Is it going to be a thoracentesis or diuretics? Oof. Thoracentesis or diuretics? This is good. Thoracentesis or diuretic? Quickly, I see. Okay. Am I saying both? No, you can't do both. You have to do one or the other. Okay. Correct answer, the priority. Because in the questions that we're about to do, they're also priority questions. Okay. So we're going to say the correct answer, thoracentesis. Thoracentesis. All right. Because we have to get that fluid out of the pleural space. It's going to be easiest to just go and grab it and pull it out. Right. And this is why we needed to review pleural effusion, because it can be looking like other things. All right. And if you don't know that information, then it's going to be harder for you to process what I'm about to show you. All right. And this is why also I highly discourage just jumping into question banks. Okay. This is why I highly discourage jumping into question banks, because this work here has to be done first. All right. And so we can do this together very quickly. All right. So pleural effusion, though, for my readers, pleural effusion, commonly known as water on the lungs, occurs when fluid accumulates in the area between the lungs and the chest cavity. So the pleura lines the inside of the chest. Okay, so that's where we're talking about. So it lines the inside of the chest and is exterior to the lungs. So what NCLEX is going to do is they're going to try to test you and give you questions about where you're targeting the fluid and how you're targeting the fluid. So the pleural space in a healthy individual includes a small amount of fluid. So we all have a small amount of fluid in our pleural space. I have here approximately 10 to 20 milliliters of fluid with a very low protein concentration. So that's it. There's fluid there. It is a low protein concentration in that fluid. Let's learn a little bit more about it here. There are essentially two types. When we're reading in our med-surg book, we are reading that when it comes to pleural effusion, there are two types of exudate that you'll see. You're going to see transudative, or you're going to see exudative. And it is important for you to be able to just determine those two terms. So let's talk about transudative fluid. Now, this is pleural effusion, so that means you do have fluid there. That fluid is going to be what? It's trans. It's going to be clear fluid, okay? And it's going to have a low protein. Now, the description, of course, is this is fluid that's leaking into the pleural space. And so you'll have a fluid shift. That is going to be something that you're going to have to remediate. Causes of a fluid shift are going to be CHF. And we know with congestive heart failure, you're going to have fluid buildup. Cirrhosis. You're going to have liver problems? Sure, you're going to have fluid buildup. Kidney disease. Same thing. You're going to have fluid buildup. So you can see there's a cause of fluid shifting for transudative pleural effusion. All right, started peritoneal dialysis. All right, well, we know if we're putting dialysate into our peritoneum, can that fluid shift and get in the pleural space? Absolutely. Okay. Malnutrition due to low albumin levels in the blood can also cause a fluid shift. So transudative. Now, exudative. This fluid is not trans. It's not clear. It's high in protein. It is a cloudy fluid, and it is acidic. Which one do you think is worse? Do you think the transudative, or do you think the exudative fluid is worse? Okay. All right. Put in the comments. All right. Oh, I got to spotlight these. A lot of testimonials are coming in. This is Winning Wednesday. So I do like to prioritize the winning as we are studying. Okay. Licinia says, good evening, Professor Regina. I just wanted to say thank you so much. I think this is a testimonial. I will, and I did pass NCLEX RN on January 14th, 2025. Welcome back. It's been some days. You must have been partying. God is so good. I will be doing my video. God bless you. Thank you so much. Thank you so much. And I'm glad you knew where to find me to even share this testimonial with all of us. All right, let's tell her congratulations. Also, Barbie says, good one, good piece of advice I can offer you is listen to Professor Regina studying the contents that she does every Monday and Wednesday. That's right. We're going to be here every Monday and Wednesday. Rain, sunshine, sleet, hail, Christmas, all of it. We're going to be here. All right. So I had asked this question, which one is worse, transudative or exudative? And so absolutely exudative. When it talks about what it is or what happens, you have this develops due to excessive fluid, protein, blood, but it's an inflammatory response typically to an infection. So occasionally a bacteria getting into the pleural space. So the causes are going to be things that cause a person to have inflammation. It can be an infection. It can be pancreatitis, but also lupus or rheumatoid arthritis. These are autoimmune disorders that also cause inflammation. Infections like tuberculosis and pneumonia. Always, if a patient has like a tumor or cancer, it can cause pleural effusions as well. And even lung injuries where you have issues with the hemothorax. If you have done the chest tube review in my V2 program, you know hemothorax, you know pneumothorax. These are causes of exudative, pleural effusions. Symptoms, chest pain, often a sharp pain that gets worse when coughing or breathing. Patients will have a dry, non-productive cough. There is no fluid to come up inside of the lungs, but that pleural space is irritated. Shortness of breath, difficulty breathing, that's the dyspnea. All right. And then orthopnea, when the patient is lying what? Orthopnea means their patient is lying flat, and then they will have that difficulty breathing. They'll have that difficulty breathing. Diagnosis that we can investigate, patient will be getting that chest x-ray. If patients down in the room, they are usually doing portable chest x-rays, right? If you've ever worked in ER or even some med surg, I guess you can do a portable chest x-ray depending on the size of your hospital. That should be done at the bedside for that patient. You can also do a CT scan or an ultrasound of the chest as well. So that's how we would investigate pleural effusions. For NCLEX, you are familiar with these diagnostic exams. You're familiar with if your patient can eat or not eat before them, and if there's any medications or that you expect to give. So here with these three, are we expecting to allow the patient to eat? Can the patient eat before a chest x-ray or a CAT scan or an ultrasound? Can the patient eat? Absolutely. All right. Do we have to have a consent for these 3, or can we just do them? Is a chest x-ray part of standard care? When you come into the hospital, do you expect to get a chest x-ray? Or do you have to have a consent for a chest x-ray? Do you think? It's Winning Wednesday. We're getting into it. Okay. We're getting into it. Yes, we need a consent. We need a consent for all 3. We're going to do that. And as nurses, remember, let me say this. Look me in my eyes right here. Look me in my eyes right here. Nurses, we never get a consent. Okay? I don't care how friendly you are with that doctor, how funny he is, how nice he is to you. If he asks you to get a consent, you are going to take away all of that. Okay. All of maybe your desire as a new nurse to be a people pleaser. Because sometimes new nurses, we have that. We want everybody to like us. We want our patients to like us. We want our peers to like us. We definitely want the doctors to like us, But if a doctor asks you to get a consent, I want you to think about all the hard work it took you to get that nursing license and to find this job, and you interviewed for the job and you just getting paid good for the job. And I want you to look that doctor in the eye and say, I want you to say it like a 3-year-old when you tell him it's time to take a nap. I want you to say, no, I'm not doing it. No, I'm not doing it. It'll be just that easy. Just think about a 3-year-old. They have no shame in their game. They'll tell you no in a minute. They'll tell their mother no, their father no, their grandmother no. They'll say no. I can only witness it. Okay? That's not our job to do. Because if something happens to that patient, they're going to certainly ask. If something happens to that patient during that CAT scan, something happens during that chest x-ray, and the patient says, I never wanted this anyway. I never wanted this anyway because I didn't know that this was going to happen to me. They're going to say, but you gave a consent, all right? And then the answer is going to be like, well, yeah, the nurse, okay? And then the nurse is going to get in trouble. So we're not going to do that. We're not even going to go down that road. Also, to investigate, you can do that thoracentesis. That pleural fluid analysis can tell you what is the substance of this pleural fluid, what are the characteristics of it, or a bronchoscopy as well, right? Treatment. Okay, so we looked at the surgical treatments that you're going to be doing, also including diuretics can get it done, antibiotics. If the patient has treatment for heart failure, because you want to look at the cause of it, right? So if the patient has congestive heart failure and the fluid shift, if it's transudative, fluid shift is leaking into the pleural space, we got to fix that congestive heart failure symptom. Okay. If it's caused by a tumor, then we're going to look at chemotherapy, radiation. Thoracentesis, we talked about it, a tube, thoracostomy, a pleurodesis. You should know what a pleurodesis is. Everybody should know what that is. If you don't know, I want you to write it down really quickly or look it up so that if you come across it again, you will have knowledge of what it is. Or a thoracotomy. These are all treatment options for pleural effusions. Okay, our nursing interventions, these are things that are priority for us. We want to evaluate the lung sounds for adventitious breath sounds. We talked about with pleural effusion, that is going to be a diminished or a low breath sound. We're going to examine the client's respiratory characteristics, looking at the breathing pattern, the depth, and the rate, monitoring pulse ox, put patient in that high Fowler's position. For the client with a chest tube, you need to know about caring for a chest tubes, whether you're an RN or a PN. Looking at the site, the skin at the location where the tube was inserted. Okay. Examine the area around the tube. Okay. For crepitus, especially if you have a chest tube, crepitus means that there's air underneath the skin. And we're wanting to look at that drainage, the volume, the color, the consistency, and looking at alterations. Whew. Okay. Getting into the rest of the curriculum in the V2 is going to be very important. The reason why I do these classes on Monday and Wednesday is to expound on the things that you are studying. because sometimes we want to go deeper into the subjects. And so on our weekly sessions, we can do that. But the whole undertone of the foundation of what you're supposed to know for NCLEX and how you get it done faster is in the V2. Okay, it is in the V2. NCLEX question times. Okay, let's go. Let's put the rubber to the road. Okay, let's put the rubber to the road and see if you have taken hold of the knowledge that we just reviewed. Here we go. Question number 1 is this. A nurse is reviewing the laboratory results of a 60-year-old client with a pleural effusion. Which of the following laboratory findings would most likely indicate a complicated pleural effusion requiring more aggressive intervention? Number 1, serum protein level of 7.0. 2, pleural fluid pH of 7.0 and glucose level of 40. Okay. 3, a serum LDH level of 200. Or 4, pleural fluid pH of 7.45 and a glucose level of 100. What are we going to find would be most likely? Yeah, look at you guys. Look at you guys learning. Okay, you're using what you learned about this subject to answer questions at a high level. This is a high level question, meaning if you didn't do a review of pleural effusions, this is a question that you would definitely be guessing on. All right, so I actually see a lot of the right answer here. I'm so proud of you guys. You showed up to class on time. You understood the content that we went over. Absolutely. Number 2, because this pH is acidic, we know that that is indicative of an infection. All right. And so this is going to be a sign that the patient has gotten worse. Okay. Looking at that pH level. So good. This is why you come to class. This is why we do this every Wednesday. I do want to stop because we had a prayer request for Nurse Leah. I'll just read it. I'm very familiar with Nurse Leah. Most of you that are regulars here know that Nurse Leah shows up to class. Hi, everyone. I'm having surgery tomorrow and a little scared because I was told by the spinal surgeon that the fall I took last week did lots of damage to my lumbar spine. He has to do a lumbar decompression surgery. I have studied so hard for my NCLEX coming up in 2 weeks, and now I'm dealing with pain. Oh my goodness. I can't push back my date because my ATT will expire. Please continue to keep me in your prayers. You know what, man, I really, you know what, I'm going to use what we talked about, and I'm going to reframe it and just speak positivity. You know, nothing takes God by surprise. And I am so grateful that you're able to get the surgery that you need. And I'm so grateful that tomorrow you will have this issue moving on to a different stage, and you won't have the pain of today tomorrow. I'm claiming that. The Bible says that by Jesus' stripes, we are healed. We are healed. And so I'm asking that we all just take a moment. I know we might be really busy and you have something to do, but let's just take a moment and let's lift our sister Leah up in prayer as she is preparing for surgery tomorrow. And we are praying that there is no fear and there is no anxiety. Okay. Heavenly Father, we thank you so much for this opportunity to just come before thy throne of grace, Lord. We come not needing anything because you have provided all up even until our own salvations. And so we praise your name for your faithfulness to us. But we want to just lift up our sister Leah to you, Lord, because she has a procedure tomorrow. And I just want to ask that all the angels that would be able to encamp around her be there for her protection, and that you would guide the hands of the surgeon, Lord, and that you would make it so that the problem is corrected, and that you would guide not also the hands of the nurses, and you would send appointed ministers to her to be at her bedside and attend to her. that at the end of this test that she would have a testimony. And even until her NCLEX in 2 weeks, that you would give her a supernatural healing, Lord, not only in her body, but in her mind, that she would be clear-minded during the exam, and that by God's grace, there would be no pain for her, and that she would pass the test successfully and give you the glory and the honor in the end of it all. We are expecting this testimony. We believe in your power, God, and we agree. And all the Remar nurses say, amen. Amen. We count it all joy. We count it all joy. Thank you so much, Leah, for reminding us what God can do. All right. All right. We are going on to our next question. Are you ready? We're going on to our next question. It is question number 2. Which of the following assessments is the nurse's priority for a client with pleural effusion? Okay. Number 1, is it pleuritic chest pain? 2, okay, adventitious breath sound. 3, tracheal deviation. 4, oxygen saturation of 95%. Okay. All right. This is a good one because I'm asking you for the priority assessment. Oh, this is so good. All right. Awesome. Okay. Is it you have a patient, they have a pleural effusion. What's your priority when you come into that room? Pleuritic chest pain, adventitious breath sound, tracheal deviation, or oxygen saturation of 95%. What are we going with? You better have that answer right, okay? And it is this one, going back to fundamentals, adventitious breath sounds. This is it. This is it. That change in a respiratory status is going to be seen first through the breath sounds. You know how early, the first week of nursing school, they talking about breath sounds. This is our priority. Okay, because look at this. Let me see if I can go back. I hope I can go back. Pleuritic chest pain, that's not going to ever beat breath sounds. Pain, nope. Tracheal deviation, now this is a good one. This was my good distractor for this question. Although tracheal deviation is, your patient's bad, but is this going to happen early or late? Tracheal deviation is going to happen very late. So your priority would be the patient's breath sounds, okay? So that's why that one is for those of you who you fell into my trap. You fell into my trap. It's 2. All right, I'm moving on. Here we go. A client with a large pleural effusion is experiencing severe dyspnea, tracheal deviation to the opposite side, and oxygen saturation of 84% on room air. What is the nurse's priority action? Number 1, administer IV diuretics to reduce fluid overload. 2, encourage the client to take slow, deep breaths to improve oxygenation. 3, place the client in Trendelenburg position to increase lung expansion. Or 4, notify the healthcare provider. What are we doing here? What are we doing here? Okay. Now tonight is the night of distractors. All right, because I was let me just say this kind of scenarios to me could be very easy, but we are testing you tonight. Correct answer is number 4. Notify the healthcare provider. Yes. Okay. This is going to be the priority. Good job. Good job. Good job for those of you who were able to see this one. It was tricky. It was tricky here, but we're looking at definitely a change in the patient. That tracheal deviation, you got to notify the doctor. Yeah, it's an emergency. All right, let's try another one. I'm moving on. A nurse is caring for a client with a left-sided pleural effusion. The client has dyspnea and a productive cough. The vital signs are blood pressure 145/90. Okay. Heart rate 88, respirations 26, oxygenation is 96 on 2 liters nasal cannula. Which of the following nursing interventions should be the priority? Number 1, increase the oxygen. 2, place the client in high Fowler's position. 3, prepare the client for thoracentesis. Or 4, administer intravenous diuretics as ordered. Whew. What are you going to do? What are you going to say? This is really good. Okay. All right. This is actually our final question of tonight. Our final question of tonight is right here. This has been such a good class. Whoa. Okay. This has been such a good class. Correct answer is number 2. Number 2. Yes, I am confident. If you pick number 2, that you're a safe nurse. You're not just a REMAR nurse, you're a safe nurse, because sitting that patient up, let me see what other answers. I like this. 4 out of 4 after the review, Jackie said. I love that. I love that. That's what I'm talking about. So most people said number 2. I think there was a few people that said maybe 4. Maybe you guys came in late, 3 or 4. Yeah, so placing the client in a high Fowler's position is going to be the priority in this scenario because it's the fastest one. It's what you can do first. Not to say that the other ones are not right. They are right, but for NCLEX, we're always looking for not the right answer, but the priority, okay? That's the difference. And so, again, I want you guys to remember that every Wednesday at 9 p.m. Eastern Time, you will find that we have something like this going on. All right. And again, this is all part of our mission. We got to keep the main thing the main thing. So I will see you guys. Don't forget to sign up for the Love Your Content review that's happening. Okay. Love Your Content review that's happening in just a couple weeks. Because can you imagine that we're already almost out of January? Like, where did the time go? Where did the time go? We're into February. And so February 12th and February 13th, Valentine's Day week, we're going to spend 2 days together. That's a Wednesday and that's a Thursday night at 9 p.m. Eastern Time. So if you're in Asia, on the other side of the planet, it may be 8 or it may be 9 a.m. Okay. So we're just going to convert that time and we're going to do Love Your Content. Do me a favor, go to my website, but put this in remarnurse.com/love, okay, to sign up for that event. And we'll be getting the workbook out to you. Actually, the workbook is already done. Praise God. The workbook is done. So we'll just have to just clean it up and get it out to you. So thank you guys so much for just taking the time out for Wednesday. I know you have a lot of things to do, but guess what? You studied. So check that off your list. And remember, as always, you can, you will, and you must pass NCLEX. See you later. Bye-bye.